Hello?
Hi, can you hear me?
Yes, welcome to the People Before Politics radio show. How are you doing? And I want to thank you for taking the time to call in, sir.
My pleasure. Who am I speaking? I have the pleasure of speaking with whom?
This is AJ Woodson. I am one of the hosts and the editor-in-chief of Black Westchester, along with my co-host.
Heard a lot about you.
Thank you.
Pleasure to talk to you.
Yeah, I've met you a few times at a couple of Yonkers political fundraisers and functions. And we have the lovely Lorraine Lopez.
Hi, Dr. Rabadi.
Oh, yes, Lorraine, of course. How are you, Lorraine? Long time.
I know. It's good to hear from you. Thank you for calling in, sir.
Now,
always a pleasure. Yes, Tasha's a good friend of ours. She invited me over, and thank you for having me tonight. I appreciate the opportunity to speak.
Yeah. Now, one of the main reasons Damon and I wanted to definitely talk to a medical professional, and as soon as we said we needed one, Lorraine said you were the perfect person for the job. So we definitely had reached out. We wanted to reach out to you. There was a lot of misinformation. There's a lot of people that don't understand what the coronavirus is. And, people just don't know what to believe. And we hopefully would like to inform the audience a little bit after this, after you speaking, that to educate them a little bit better on what. First off, what is the coronavirus? Let's start there. Some people just don't know what that is. What is the coronavirus?
Sure, right. So the coronavirus gets its name because of its shape, the corona head, crown-like shape. It's just like any other virus. It stems a lot from, if you remember, the MERS and the SARS that had infected China and the Middle East a few years back, and the corona COVID-19. That's the name they're using now, the COVID-19, which is the novel corona 2019 virus. That's how they get those initials.
Oh, okay.
Okay.
The COVID-19 is a stem off a mutated virus that got really smart and knew how to change its shape and developed a lot of resistance to our immune system. The MERS, the Middle Eastern Respiratory Syncytial Virus, and the SARS were the preliminary ones, and the corona kind of stemmed off of those. There's lots of rumors out there. There are lots of stories. Right now, we know that the coronavirus has been out for a long time. I remember the coronavirus when I was in medical school in 1996, reading about it. But obviously, it's evolved and has adapted and caused this pandemic across the world right now. The coronavirus, just like any other viral syndrome, causes the same symptoms, but the coronavirus has not only caused the same symptoms, but has affected the entire world right now in a fashion that we haven't seen since the H1N1. Remember that one, the H1N1 in 2009?
Yes.
So I'll get to how I feel later, but right now, just to kind of inform everybody, the coronavirus is a viral syndrome. There is no antibiotic. There is no immune vaccine that we can give immunization. We kind of just let it run its course. The good news is this. I've had probably 3 positive COVID-19 patients in the past month, and all 3 patients are doing just fine. They're young, healthy people in their 40s and 50s that don't have another comorbid disease that can lower their immune system. So they're pretty much healthy people. The disease runs its course after probably, I would say, 5 to 7 days of fever, cough, shortness of breath, and headache. The swabs that I do, it's a nasal swab test that I do in my office now. I just got it on Monday. I got my first positive this week.
Wow.
And that patient is doing just fine. I talk to him every day. And that's the instructions. At the press conference the other day with the mayor, I hope what we said at the press conference kind of calmed everyone down. It was just basically a message. If you feel like you've been in contact with somebody with the COVID-19, or you yourself have the COVID-19, just quarantine yourself. Stay home. Stay in one room. If you have the capabilities, not everyone has multiple rooms in their house. Not everyone has multiple bathrooms. If you're sharing a bathroom with someone, wipe the bathroom down with some kind of cleanser before and after you use it. Wipe the doorknob down, the faucets, the handrails in your house. Never, ever share utensils. This is not a good time to share utensils and dishware. You want to wash everything with hot water. Wash your hands with hot water if you don't have any sanitizer. Sanitizer these days, Lorraine, is tough to get a hold of.
Oh, yeah, I know.
It's tough to get a hold of sanitizers right now. So if you don't have sanitizer, just wash your hands for at least 20 seconds in hot water and soap. That'll do the trick. And just quarantine yourself. Be in touch with your primary doctor. If you don't have a primary doctor, you can call the hotline in Yonkers where we're using right now is St. John's Hospital. It's the 964-4706 number.
All right.
What about people outside
that's the hotline for Corona at St. John's Hospital.
What about people outside of Yonkers, like the rest of Westchester County? Is there a Westchester County number? Or?
Yeah.
Yeah,
Right.
there is.
So people that don't have the capabilities of don't have a primary doctor and don't have that, I would say call the DOH. It's tough. The problem is right now, AJ, the DOH, it's so backed up. I was on the phone with them yesterday to report a positive case that I had, and I got a machine, left a message that's checked every hour, and then they did call me back, and then after probably 3 hours after that, a nurse practitioner called me to discuss the case with me. So you're talking about 4 hours until someone got back to me, and I called in as a physician.
Wow. Now, one of the biggest misconceptions, and people have been asking me this, and I've seen this on various news analysts and talk shows. If you catch this and it runs this course, can you catch it again? You know, like some things, once you get it, you're good. But is there a danger that you can be reinfected with this again?
Yeah, you know what I worry about? It's a good question, AJ. What I worry about is superimposed viruses, meaning let's say I get the COVID-19 today, it runs its course in 2 weeks. That doesn't mean I can't get the flu later on during the same season, which gives me the same symptoms.
Okay.
Right? The COVID-19, once you're positive, you're positive. It runs its course. It's not like you're going to keep getting a recurrent COVID over and over again.
Mm-hmm.
Okay.
That's good. That's good. You know what? So let's rewind a little bit. Tell everybody who you are first, though, because we haven't really introduced you properly and talking about.
He's the great Mr. Dr. Rabadi. Everybody knows.
So for those who don't know,
so Ammir Rabadi is my name. I am born and raised in Yonkers. Went through the entire school system here. Went to Manhattan College. I went through New York Medical College through a program in Guadalajara, Mexico. They have an international medical program there. I went there for 2 years, came back to Valhalla at Westchester Medical Center and did my training there as an internal medical doctor. And then I did a critical care and family medicine through St. Joseph's in Yonkers and Winthrop Medical Center in Long Island. So I did about 5 years of training through family medicine, internal medicine, and critical care. Graduated in 2008 and went into education. I am a clinical professor at New York Medical College in Valhalla, where I teach family medicine. I have my own private practice. I am the medical director of education at St. John's Riverside Hospital. I am also the medical director at San Souci Nursing Home in Yonkers, and I am currently the chief police surgeon for the Westchester County Police. I also like to help the community. I have a volunteers positions where I am the health advisory chairman to Mayor Spano, and I am a trustee for the Board of Education for the city of Yonkers.
Wow. Okay.
Thank you so much for all you do, Doctor.
This is what
they call it, going above and beyond.
Right. I just wanted people to hear that. Like, you know, we're not just bringing somebody on who's just running off some numbers and stuff like whatever. You know, we have a qualified medical professional who knows what he's talking about, and that's one of the things we wanted so that we can get the full facts out there. So and Lorraine ran down some numbers earlier. I'm sure if you were tuned in earlier to the show. I heard there's some new cases in Yonkers now. People really don't know what to believe with all of that. So do
What's
you know
the biggest
numbers?
misconception? Yeah.
As you go, what's one of the biggest misconceptions that are being put out? About
Biggest
this?
misconception is if you're healthy and you have a past medical history that's basically really boring, and let's say you come across this disease and you're positive, you're not going to die. It's very unlikely you're going to die. Think about the numbers right now. Less than 3% of the people that have contracted this disease have died. So that means there's a 97% chance you're going to be okay. So I like the odds.
Right, absolutely. Who's the most endangered? Again, reiterate that.
Great, good question. And we've been hearing a lot about that. The other day, CBS interviewed me, and that's the question they were asking me. It's the elderly population. Their immune systems are lower. They're not as strong as they used to be. It's people that are on multiple medications for things like diabetes. Let's say someone's status post like chemotherapy. Those are the ones I worry about the most. Okay. People that contract the disease and lose their appetite and can't tolerate liquids and get dehydrated, and they're elderly, they're living at home alone. Those are the ones I worry about the most. Young, healthy people, this disease should really run its course, and it's not going to be comfortable. It's not easy. You're going to have a week of fevers and chills and headache and nausea. It's going to be a miserable feeling for a week, but you will get through it.
Now, once you get this, for those who, because I think it's evident that some people will get this. Once you get this, what do you do? They say like you can self-quarantine yourself for 2 weeks. What things should you be doing during that time?
So let me give you an example, AJ and Lorraine, of a patient that I just had that was positive last week. So he is a young, healthy male in his 40s, was at a sporting event, noticed that one of the competitors had didn't look good. He said the person looked ill to him. Mm-hmm. And after the sporting event, he noticed about 3 or 4 days later, he developed fevers. He felt weak and tired, called me. I brought him into my office on Monday. He's actually the first person that I swabbed for the disease. Swabbed him on Monday. I told him in about 3 to 5 days I should have the results. I said, in the meantime, I want you to quarantine yourself because that's the recommendation. So he went home. I took him out of work. He stayed home. He called me 3 or 4 times a day. I gave him my cell number. I said, please call me. It's an interesting case. I thought that this was like a flu or some viral syndrome. I didn't think he was positive for the COVID. Mm-hmm. Anyways, during the week, he would call me, check with me. He's like, Doc, I got fevers, but I'm able to eat. I'm able to drink. I'm home. I'm doing exactly what you're telling me. I'm staying away from my family. I'm in my room. I said, good. I said, continue what you're doing. And then Tuesday and Wednesday and Thursday, touch bases with me. Finally, Saturday, I got the result that he was positive for COVID-19. And I said to him, I said, listen, you're positive. I said, let's look at the glass half full, not empty here. I said, you're still with us. It's been about 10 days that you've been positive, and you're still with us. Talked to him yesterday. I talked to him again today. He's doing just fine. In about 2 to 3 days, he'll be back to his normal life. He'll be out of the quarantine, and he'll be back to work. And he'll no longer be infected. So he can't infect his coworkers or anything like that.
Wow. And one of the other things I've been hearing a lot of talk about, excuse me, are the mask. Like, there are a lot of people just buying these generic masks all over, and they're walking around with them. But there's some of these masks are not going to prevent you from getting this. And
that's not what they're
what's
for.
recommended right now.
Right.
Yeah. So it's not what they're for. The masks are not. Right now, so for example, we were at St. John's Hospital last week. I was in the emergency room working, and there was a possible patient. So what that means is a patient came in through the ER and told us the history. He had just traveled from Europe, and he has a fever. So right away, when you travel from Europe and you got a fever, boom, you're going to be on the COVID-19 kind of awareness. Yeah. We put that patient in a private room. We gave the patient a mask, and we wore the N95 mask, which is the whole getup.
Right.
You know, the whole thing that you see on TV. And we were in there examining the patient until we kind of ruled out that he wasn't COVID-19 24 hours later. But, those masks, AJ, they're really not recommended. I see a lot of people wearing them. I was at ShopRite yesterday morning, and a lot of people had masks on. I guess that makes you feel good. Go ahead and wear one. But I'm just giving you my medical advice. It's not recommended.
And a lot of people are wearing the little plastic gloves. Does that help?
Here's the thing with plastic gloves. Let's say you touch a surface area that has COVID-19, right? Mm-hmm. You just protected yourself from the COVID-19. That doesn't mean you can't spread it to somebody else, right? It's on your glove.
Mm-hmm. Right. Okay. That's quick and straight to the point.
Dr. Rabadi, if you find yourself not feeling well and you think you have some symptoms, what is it that you're not supposed to do? You're not supposed to go to the emergency room, right? You're supposed to call your
Please, yes. Please do not go to the emergency room. We're overwhelmed to begin with. And by walking in there, it's really selfish on our part to do that. There's a chance, if you are positive, you're going to infect the entire waiting room and the healthcare professionals. We're already putting our lives on the line. And a thumbs up to all the healthcare professionals, by the way.
Yes.
Nobody has called in sick. No one's called in sick at St. John's. Nobody's said any excuses to us. I'm the medical director there, and I see a lot of my workers, and I just want to give them a real shout-out.
Absolutely.
On your radio station to say thank you for all of your loyalty and your concern to the Yonkers community. They're really going above and beyond the call of duty right now.
I want to actually extend that to all, not just everywhere.
in Westchester County.
Because
Yeah.
in Westchester County, we have people listening because through the internet throughout the country. So all the healthcare workers that are putting in that extra work, that are going over and beyond the call of duty, they're just performing admirably. I mean, it's a thankless job. You're risking bringing this home, not only you getting it, bringing it home to your family. I mean, but they don't let that stop them from doing what they need to do. They're preparing, they're protecting themselves, and they're doing the job. So I'm glad you brought that up. I want to applaud all of the healthcare workers out there,
as well as our first responders, the police and fire
yes.
and EMS. They're also putting their neck on the line out there when they're picking people up in ambulances and doing their calls.
Yes, they are. They really are. So do not walk into the emergency room. Call your primary care physician, and your primary care physician will take it from there, right?
Right. So
Basically.
the primary care physicians, every day I'm getting emails from the DOH. I'm assuming most of my colleagues are getting the same emails. It's questionnaires of us how to kind of dissect over the phone each patient's questions to kind of rule out who is a possible suspect of the disease and who isn't. So those questions are really important. And if you want to go over those questions, I'll be more than happy to go over those questions.
Oh yes, actually, can you? Yeah, that would be great.
So the first one, obviously, is any recent travel. If they answer yes, that takes them into the category. Has anyone been a positive COVID-19 patient? That obviously takes you into the category again. Have you had any fevers unexpectedly? Have you had any chills? Has anyone in your family been ill? Any recent sick contacts? So those are the three main questions that we ask. And then after that, we ask symptomatic questions. Have you been taking your temperature? Are you having difficulty breathing? Is there a headache? Is there a cough? Is it a productive cough versus a dry cough? Those are the kind of questions the DOH really wants us to kind of ask the patients.
I had a doctor's appointment this week and an eye doctor's appointment this week, and I had to answer those questions over the phone before I could come in to those appointments. They definitely asked.
But AJ, I'll tell you this. I probably have seen, and I think this is going to make everyone feel a little better right now. Over the last 2 months, I've seen so many patients with those symptoms, and I've swabbed them for the flu or any like other viral syndromes, and they've come back negative. And I just assumed, and most of my colleagues, we assumed that these patients just had some kind of weird bug. Just until recently, we figured out, you know what? Those patients were probably COVID-19 positive. They just went just kind of like right under the radar.
Let me ask you a question, Dr. Rabadi. Children, they seem to be a little bit immune to it. Is it because the immune system is developing, or is there any reason?
The ones most children have good immune systems in this area, unless they have again some underlying disorder. But it's the newborns we worry about.
Oh my
Those
God.
are the ones that are higher. It's the newborns and the elderly are the two age groups that we worry about the most.
Now, you touched upon this a little bit. Whether we like to believe it or not, there are a lot of people, some that are listening in the 43 municipalities of Westchester and the surrounding areas, who do not have health benefits, who do not have primary care doctors, physicians, and what do they do? And I'm sure we have immigration and stuff like that where people are scared to go anywhere because we have an immigration situation that they're scared of ICE or whatever, so they may not they don't have someone that they can call, what recommendations would you make?
So I would look for a public clinic that's out there. I know I'm not sure. I know your station goes broad around Westchester. For Yonkers is what I know best. I know at Park Care on Ashburton Avenue, they have a clinic. St. Joseph's Medical Center on South Broadway has a clinic. They have two of them right on South Broadway, at 415 South Broadway and at 75 and 81 South Broadway. Those are clinics. You can just walk in. You pay a flat rate of $50, and that $50 covers your visit and your lab test.
Okay.
That's not bad.
So, is there somewhere a number they can call or a website that they can go to find out where they can go if they're not in Yonkers? If they're in any other place where they can find out a safe place for them to go. They don't have benefits, they don't have a physician. But what do they do?
Yeah, so Westchester County, the Westchester Medical Center in Valhalla is a safe haven hospital for people of Westchester County. The DOH also has multiple clinics that go around Westchester County. You got to go on the website and find those clinics. If you don't have internet, you can call those numbers for the DOH. I gave a number earlier for St. John's Hospital, 964-4706. That's 914-964-4706. They can direct you to their clinic, which is on Ashburton, the old Yonkers General Hospital. That's a nice big clinic that's up right now, that's up and running with multiple medical providers.
Okay. Show me that again, Lorraine, or can you post that?
Yeah, there's a New York State coronavirus hotline. And the number to that is 1-888-364-3065. And this number is the number that you also call if you want to go into the drive-thru in New Rochelle.
Okay.
This is the number to call.
Yeah,
I'm going to post it.
Can you post that? Yes.
Right. And they ask you questions before you go into the drive-thru to see if you're actually a candidate for that test or not.
You have to call this. You have to call this number to see whether or not you and then you have to go and buy an appointment. Yeah.
One of the things, we got a lot of calls this week from people that are in the 5 boroughs. So when they see the news and they hear about the National Guard in New Rochelle, the story says in Westchester, because they're from the 5 boroughs. I've gotten calls, and people that I know have gotten calls. Oh man, the whole Westchester shut down. The National Guard's all over the place. That one incident is, as far as I know, only in a 1 mile area in New Rochelle, not the county of Westchester. But if you're a New York City news organization, you're saying in Westchester, and it sounds like you're saying, so people are calling their relative thinking like all of Westchester is shut down. I've seen a lot of that this week.
Right, and that was Governor Cuomo's call. He closed an area called Waikagil. It's an area in New Rochelle where that synagogue was that had the first few suspects, the first few patients. And it was a 1 mile radius because he felt that was the hot zone. And what I mentioned the other day, Westchester County right now is at one big hot zone. And if you look at New York State, how many have been affected? I don't know, Lorraine, the numbers for the day, but as of yesterday, Westchester County was still the highest rate.
We got 196 today, sir. 196 today.
Yeah, 196.
Yeah.
So for a while, I heard New York City's trying to catch up, but Westchester is the number one area, the number one county in the state of New York right now.
Dr. Rabadi, how? I don't want, without making it sound scary, how bad do you think it's going to get for us?
I think this disease will run its course. We're looking for a plateau right now. The curve is going up. We're just, every day we're getting more and more patients that are positive. We need to plateau, and that's why I kind of agree with Governor Cuomo. I think Governor Cuomo, by the way, is doing a fabulous job.
Oh my God, isn't he?
He's doing an awesome job. This is like presidential material, what he's doing right now. Very proud of him. Proud to be a New Yorker right now. I think by doing the social distancing, closing the schools was a difficult call. I'm part of the school trustees, and that's a tough call because a lot of kids rely on schools for safe haven and for meals. But I think we have to distance ourselves for the next 2 weeks. I personally feel my medical opinion, this is just my medical opinion, I think in about 2 to 3 weeks, this whole thing will blow over.
Do you?
I have a faith in that too.
Yeah.
Dr. Rabadi, the Yonkers Public School is going to be closing for 2 weeks.
So Monday and Tuesday were closed so far.
Yes.
There is, I can't discuss too much of that right now, but there's some possibility that we may be closing longer.
Okay.
And like I said, I've been informed Mount Vernon is closed for at least 2 weeks. Westchester District Attorney candidate Mimi Roca told me her kid's school in Scarsdale is closed for about 2 weeks. I know New Rochelle schools are all closed, and I know there's several other municipalities that are doing this closed. And I even just talked to my aunt in Georgia. Some of the schools down there are closing for 2 weeks. So a lot of the schools are closing. I think that's good, and the opportunity to clean the schools. One of the things I was talking about early, I just wrote an article about March Madness 2020 being the month that sports became a casualty of the coronavirus. Like, this is the first time in my lifetime, I'm 54 years old, where there is no basketball in March. This is unheard of, and every major sports league has shut down. This is unheard of. It's there are sports fans losing their minds right now because there's no sports. Even the Masters is shut down for the first time since World War II. This is the first year it will not take place. I know that is a lot of people are concerned about that. Are you there?
Right, yeah.
Oh,
yeah. Sports are definitely a big part of this country, a big part of society.
Right.
And you look at what sports does; it brings people together. Sports bars and coming over my house to watch the big fight and UFC and those type of things. Right now, those things are not available, and it makes us understand how great life is, and how wonderful, and how we take things for granted sometimes. And we look at us as Americans. We live in the greatest country in the world. That's why our parents brought us here in the 1950s and 60s. This is the greatest country in the world. And we take things for granted sometimes. Things like water and having food in your refrigerator and being able to turn the TV on and watch a game and kick back and crack open a beer and enjoy the game. Those things are not available right now for some people. And we pray for them. We wish everyone to be safe and healthy right now. As a physician, I say to everybody, continue to sanitize, clean the surface areas at your house, the railings, the doorknobs, hug your families, kiss your families. Just make sure you wash your hands first.
Right, and I just want to go over that one more time for those that are concerned, things that you can do to prevent and as a precaution. The washing of the hands for 20 seconds is very important, and the wiping down, I want you to, if you could just reiterate that, because that is so important.
Right, so surface areas are any areas like counter spaces, railings, doorknobs, your phones, Lorraine, right?
Yes.
The phones.
Yes.
Don't forget your phones. Clean your phones, especially when you're passing your phone around speaking to family. The tables, your kitchen tables, the chairs, your bureaus in your bedrooms, these type of things. Make sure you guys all wipe them down every single day, at least once. Once is not enough. At least 2 to 3 times per day. Just wipe them down, especially if it's a heavy traffic area.
Right.
If you can keep the surface areas clean and spray them down with Lysol or some kind of Clorox wipe or bleach, something with a strong chemical compound in it, it has shown evidence that it decreases a virus's lifespan. So you can wipe out a virus very easily by just continuing to sanitize.
Yeah, that's why we have to be proactive. Yeah.
I even do my doorknobs too. That's.
Dr. Rabadi, I have a question. The weather's getting warm outside, and there's a possibility. Well, it's a fact for many, but there's a kids staying home. Do you recommend that the parents take them out to the park?
Yeah, I took my kids to the park. I mean, listen, they're kids. I really haven't explained too much of this virus to my kids. I have a 10-year-old, a 9-year-old, a 4-year-old, and a 2-year-old, And yesterday we went to the park. We played some basketball. The kids played on the slides. It's important to do that. I'm not saying you have to go there and sanitize the slide and the swing. But you just got to be careful. Make sure your kids are dressed. And when you come home, take the children and make sure they all clean up and wash their hands and wash their, obviously clean themselves up just to kind of desanitize. But definitely the kids need that fresh air.
Yeah, that's good to know.
That's a bad thing to do.
I'm glad you said that. Yeah.
And I mean, it led me to one of the questions I was going to ask you. There were people, like you said, if they self-quarantine themselves, does that mean like they can't go on their front or back porch? Like they have to stay in the house or in their room? Like can they like sit on their porch, or they can't? They should stay in? Or what do you recommend as far as that?
What level of quarantine? Yeah.
Right. So level of quarantine for someone who's been exposed to disease or positive for the disease, AJ?
Well, both.
Both, and then people that are just been exposed. Yeah, both. Actually, both. If you can explain both.
So let's talk about the extreme would be if you're positive for COVID-19, you want to quarantine yourself to one area of the house, make sure no one goes into that room. And again, I said earlier, not everyone has the luxury of having multiple rooms in their house. So if that's the case, that person that's positive should wear a mask, should clean up the surface areas whenever he or she are leaving that room. So if they have to use the bathroom and there's only one bathroom in the house, the counter, the faucet, the toilet, the lever on the toilet, all of that stuff should be sprayed and cleaned before and after they use it, and back into the quarantine area. For someone who is suspected of having the disease, very similar to the same thing, but I have a husband and wife right now that one of them is on quarantine, and they decided, you know what, we're going to both go through this together. And I was fine with it. I said, he's not positive yet, so if she wants to hang out with you, I'm okay with it. But if you develop any symptoms of fever, headache, any of the main symptoms of the COVID, shortness of breath and cough, then you got to get tested. And once you get tested, now your wife is going to be quarantined.
So if somebody tests positive in a household of like 5 or 6, do the other people there have to self-quarantine?
Right. So that's the domino effect.
Yeah.
If one person is positive, they're positive for COVID-19. The rest of the family now has to be quarantined.
Oh wow.
That's the guidelines from the DOH.
I want to thank you for your time, because I understand. Time is very important, and I thank you for sharing all of this with our audience. I want to know, like, if there's anything I did not ask you that you want the people to know, or any message you want to definitely make sure that you impart on them, that needs to be even though I'm a medical doctor, I got a strong natural side to me, and I think natural medications right now are really good. Things like meditation, immune boosters like vitamin C. I'm a big fan of vitamin C. I think right now is a good time to kind of boost your immune system, and eat healthy, drink plenty of water, fresh fruit and vegetables, eat some protein every single day, take your vitamins. I think stay sharp mentally. Any disease that's positive not only affects the body, affects the mind also. So I tell everyone to make sure you get your exercise, walk around the block. Don't just isolate yourself at home all day. That's not healthy. Get out of the house, get some fresh air. Just don't go into a packed, crowded area.
Don't panic, right?
And don't panic. We'll get through this.
And we
will get through this.
Do you think it's a good idea if people are, because there are a lot of people that are like terrified to reach out to a health professional for some like therapy or something?
Yeah, I know Montefiore Medical Center has a great behavioral group that has a strong outreach to the community. If you have the capabilities to call Montefiore and just say you want to speak to one of the behavioral specialists, they'll be more than happy to get on the phone with you.
Well,
and again, I offer this to everybody. I'm only one person. I can only take care of so many people. But please, if anyone has any questions out there, my office phone number is 914-476-8855. I'll be more than happy to help you in any case of emergency. But again, I'm only one person, and I have a very busy practice. But if you're stuck and you have nowhere to turn, just call my office. Tell them, listen, Dr. Rabadi, I really just need to ask him a question about this COVID-19. I'll be more than happy to pick up the phone free of charge to talk to you and just kind of guide you through this.
You know what? I applaud you on that. I definitely.
Dr. Rabadi, you're an amazing human being. Thank you. Thank you.
And again,
Listen, every one of us has to help right now. I think this is the time where we come together as a community. I'm going to talk about Yonkers. I know you guys are Westchester, but for Yonkers, I want us to kind of pull ourselves together. Let's stay strong, and let's get through this. In the next couple of weeks, we'll get through this. And next year, this time, we're going to have to deal with another virus. But let's enjoy the next 11 months until something else comes out.
Again, I want to thank you for your time, and that really means a lot to take your time and your expertise and share it with our audience to educate. And I know we concentrated a lot on Yonkers, but a lot of what you said is universal.
Applies to everybody.
And yes, and no matter where you live, this information can be utilized and very useful. So I want to thank you again. Have a great rest of the weekend. My prayers with you be keeping safe, especially as you're dealing with a lot of the public. You and your family safe, staying safe.
Dr. Rabadi, is it okay if things changes in a couple of weeks? Is it okay for us to call upon you again, sir?
Absolutely. I'm here at your service anytime. You guys call me. Let's get Lorraine, come by to the office one day. I haven't seen you in a long time.
Okay. I will, sir. I will.
All right.
Thank you. God
Take
bless
care.
you
Bye-bye,
for
AJ.
everything you do.
Thank
Thank you.
Thank you for your
God bless
time,
you all.
and have
Bye-bye.
a blessed rest of the day. Yes. So I wanted to.
That was.
That was. Go ahead and introduce.
That was Dr. Ammir Rabadi that so graciously called us and answered so many questions that we've had and it actually calmed a little bit of my fears. How about you?
Well, I knew most of the answers. I'm glad to hear it.